Okay, just some motivation in terms of what we've seen since the onset of the pandemic. What happened is that the COVID-19 pandemic has resulted into a lot of restrictions coming from travel bans, and also in terms of shutting some consular services. And moreover, what happened is that there were a lot of border closures that were implemented by a lot of countries. So what does this mean for migration, basically? So what it means is that these restrictions raises some fear in terms of people trying to migrate through irregular channels, because even before the pandemic, people were using a lot of irregular channels, but during the pandemic, if these legal pathways have been restricted, what happens is that there was a fear that we'll see an increase in irregular migration. So during the beginning of the pandemic, what we observed in terms of the number of people trying to reach Europe through the Mediterranean Sea, we saw in March 2020, which was the onset of the pandemic, the numbers reduces a bit. But subsequently, in the year 2020, what we see is that in terms of the number of people trying to reach Europe through these irregular channels, actually increased. If you compare between 2020 and 2019, the number of people that cross the Mediterranean Sea actually increased by more than 3 times. And in particular, when you observe the people that try to reach Europe through Spain, so we saw an increase by more than 29%, by about 29% in terms of the number of people that try to reach Spain using the irregular channels. So obviously it is worth highlighting that this might be due to diversion that people were using. Instead of trying to reach Italy, people try to reach Europe through the Spain channels. So particularly in terms of the 2 main channels that people try to use when they are migrating to Spain, the 2 main channels are the Western Mediterranean route, in which immigrants enter Europe to Spain, mainland Spain. Okay, what we saw is that more than 18,000 people actually reached Spain during the year 2020. And most of these people obviously comes from North Africa, Algeria and Morocco, where some of the main places where the people were coming from. But when we look at the Western Mediterranean route, basically this is a route where a lot of people use boats coming from the mouth of West Africa, be it Gambia, Senegal, or other countries, and they try to reach Spain via the Canary Islands. So for that particular route, what we saw is that also the number of people migrating using this route increases in the year 2020. Just briefly, in terms of literature, in terms of how the pandemic affected migration, we've seen some evidence in terms of unemployment, both in the US and also within the European Union. We saw the evidence in which migrants are more likely to be unemployed due to the pandemic. This is partly because of the fact that they work in jobs that are more vulnerable, okay, to the crisis. And also we've seen some evidence relating to this that because migrants tend to work on sectors that are more vulnerable, having migrants means that the natives' exposure to COVID risk is relatively smaller. In terms of from descending perspective, from households left behind, also we've seen evidence that households having migrants actually saw a reduction in terms of income coming from remittances, and this subsequently leads to reduction in food security. So missing from this discussion basically is how has the pandemic actually affected the ability and intentions for individuals to migrate. So this is where this paper comes in. So in this paper, what we do is basically we examine how the COVID-19 pandemic impacted intentions to migrate by using a large panel survey of potential migrants that we surveyed before the pandemic and during the pandemic. So in terms of what we did, we conducted a Salient Experiment where we make COVID-19 salient by asking people questions about COVID-19, but also by showing them a short video about COVID-19. So how do we achieve this? Basically, during the fieldwork, we randomly order the sections in which individuals were asked questions related to the pandemic, and some people were asked migration questions before. But this I will explain a bit in detail subsequently. So just briefly, in terms of the main results, what we see is that making COVID-19 salient do not have effect in terms of the intentions to migrate. However, the pandemic in itself reduces intentions to migrate to both Europe and also the neighboring country, for our case, Senegal. It has reduced the intentions to migrate by 31% to Europe and 34% to Senegal. And when you look at this impact, the results suggest that these effects are relatively larger for people who are coming from poorer households and also individuals who were unsure about migrating before the pandemic. So just in terms of overview for what we've been talking about, we'll talk about the theoretical framework that we have in mind and more about the context of this study. And I'll explain in detail about the priming and the salient experiment. Then we'll talk about the main results and conclude. So how might the pandemic actually affect migration intentions? So to try and understand this, let's think about a simple model where individuals choose to stay at their home country, which we denote here as G, or they decide to move to Senegal, or they decide to move to Europe. So most of these people, actually, these are the main decisions or the main destinations that they decide to migrate. At this point, we'll highlight that actually the internal migration also it's something that people do, but because we haven't collected data on intentions to migrate within the country, this is something that you will not see in this model. But basically, we can also supplement this by the fact that as we've documented elsewhere, that the pandemic actually, in terms of job loss in the urban areas, people residing in the urban areas are more likely to be laid off. So obviously, this is something that you can keep in mind. So in terms of what, within this model, we can think at home, what do individuals, where do individuals derive income from? So basically, in this setting, people derive income from agricultural activity mostly, and also from remittances that they receive from outside the Gambia, for example. And their utility depends on their health conditions, HG, at home, and also other amenities denoted as AG. And we know that migration is actually costly, right? In particular, it is more expensive to migrate to Europe compared to if you are to migrate to neighboring Senegal. And people are obviously liquidity constrained in a sense that their wealth, they will migrate only if their wealth is more than the cost of migrating. So we can denote the probability of finding a job, PE, the E for Europe, in Europe, and PS in Senegal. So we know that conditional on finding a job, the income coming from a migrant who migrated to Europe obviously is larger than if you migrate to Senegal, which is larger than if you decide to stay in the Gambia, right? So also the utility abroad depends on health conditions, HE and HS, where E is just for denoting Europe and HS for Senegal, and obviously on other amenities. So basically, individuals will choose the destination that maximizes their expected utility. And this utility, expected utility, depends on the income and the remittances. It also depends on health outcomes and also other amenities at the destination countries. So they will decide whether to stay in Gambia or migrate to Senegal or Europe, depending on which one maximizes their utility, obviously subjected to a budget constraint. Yeah.
Tijan, I have a question. Just to understand the decision tree, do you allow for sequential migration, where someone would first migrate to Senegal and then to Europe, maybe to build some capital, or I don't know exactly about the constraints to go to Europe, but maybe through Senegal it makes it easier?
Yeah, so within this setting, you can easily migrate directly without going through this sequential, where you, I think in a lot of settings, people go kind of, they migrate to, say, even in the urban areas, where they will earn some money and then they finance the next trip, the next journey. But within this setting, given that we're talking about migration, irregular migration, people can easily sell their resources or sell their assets and go to migrate directly without doing this sequential migration. And this is something actually that it's very common for this type of migration. The people do this seasonal migration where they go to the urban areas or Dakar, but not mostly. These people, they just go and come without the intention of them going to stay in Senegal or in the urban areas in Gambia, accumulate work, accumulate money, and then food the next stage of the migration. Yeah.
Right. Thanks. Thank you.
So moving on. So basically here within this model, we can think about how will the pandemic influence the intentions to migrate through different channels. The first channel that we need to note is the pandemic actually lower income earning opportunities at home, right? And because a lot of these households, when we look at the descriptive statistics, they rely on remittances. So obviously, the pandemic reduces that income coming from remittances. So because income falls, this might increase the desire for individuals to migrate. Secondly, the pandemic actually increases unemployment abroad and lowers the income in the destination. Because of the pandemic, as we've seen, many people were laid off in Europe, for example. So what will happen is that this increases the likelihood that people will be unemployed in both destinations. Third, the pandemic also increases the cost of migrating because of this associated border closures and reduction in income and at home, right? Because income earned at home would be something that they can be able to use to finance the migration. And third, obviously the pandemic lowers health conditions of both home and destination, especially in Europe, given the severity of the pandemic in Europe. So in sum, we can say that the COVID-19 lowers earnings at home, but this is offset by the fact that there is a reduction in earnings also coming from abroad if you migrate, and it increases the cost of migrating, okay? And it makes people less able to pay, and obviously it worsens health conditions both home and abroad, but abroad, as we mentioned, it's likely to be worse than if you stay. So overall, what this means is that it will predict lower intentions to migrate in Europe and Senegal, especially for individuals who are constrained or individuals coming from poorer households. Okay. So in terms of setting, we did this fieldwork in rural regions of the Gambia. So Gambia is interesting in the sense that it is one of those countries with the highest share of irregular migrants. In particular, according to the recent labor force survey, which was collected in 2018, about 63% of individuals who migrated outside the Gambia actually migrated through the irregular migration. So as I mentioned, there is some seasonal migration happening to the urban areas and neighboring Senegal. And what we did was the baseline of the survey happened back in April and May in 2019, and the end line took place in September and October 2020 during the pandemic. So overall, what we have is that we have about 3,000 young males between 18 to 33, because these are the prime age of migration. So, and also in our sample, we focus on young males because they are the people who are more likely to be engaged in this type of migration. They are residing in about 391 settlements. Okay.
Just one question, if I may.
Yeah.
Were there any lockdown measures or any kind of strong obstacles to regular migration, whether internal or to Senegal, that maybe would have pushed people to migrate illegally and then decrease the cost, the perceived cost of the illegal migration, let's say, because any migration would become illegal?
Yeah, so yes, actually there were some restrictions implemented within the Gambia in terms of mobility. And for our interest specifically, the border between Gambia and Senegal was also closed due to the pandemic. So yeah, these were the main restrictions that were implemented during the first few months of the pandemic. Yeah.
But then do you think that it may have, in a way, because the possibilities to migrate legally, it kind of comparatively then decreases the cost of migrating illegally, because it's the only way to migrate if you want to diversify your income? Or...
Yeah, so the restrictions actually make it relatively difficult at that time for you to migrate. And this is something that we capture within the model, saying that it becomes more expensive for you to migrate. In general, whether it's illegal migration or irregular migration or legal migration. But obviously within this setting, one thing that we need to highlight is that most of these people, they are the legal channels. It's not an option. Most of them, the only way you can migrate to Europe is through the irregular channel.
I understand.
You need, yeah.
The only point was that before they could migrate legally, and then they cannot any longer. So if you need to diversify your sources of income, the only way is to migrate illegally. So, I mean, maybe then, maybe more people, I mean, maybe you observe that maybe it makes the illegal migration a little bit, I mean, it's the only option. And so comparatively, it is more interesting for many people. And maybe as well, you have a flow of illegal migrants that maybe may decrease as well a bit the cost of migrating illegally if everyone does that. But maybe if you don't observe it.
Whether we don't, what we observe mostly it's intentions to migrate. Our main results is, excuse me, it's on intentions to migrate.
Okay. I'm just thinking that you maybe need to model as well the choice of migrating legally versus illegally, and in your motives.
You mean whether, how will it affect the choice to migrate illegally compared to legally?
So sorry. I stopped.
Yeah, so for that, we actually, this is something maybe we can be able to check, because we ask individuals in general whether you intend to migrate, whether you intend to migrate, and then subsequently we ask them whether you would migrate illegally if your legal option is not. So this is something that perhaps we would be able to check, because we actually have two of them. Like we ask individual, are you willing to migrate or not? That is encompasses everything, right? Then subsequently we ask them specifically the illegal channel.
Yeah, thank you.
Yeah.
Just a follow-up question about the data. So do you have any measure of whether they actually migrate after that they have declared they are thinking about it? And for instance, did you also ask families whether some members already migrated in the past?
So what you will see here is for only individuals that we were able to survey. So most of them it's intention, but subsequently we have some data at the end after the field work. We have data in which we try to ascertain individuals that were not found during the end line. We try to ask their relatives, and also we elicit some information using WhatsApp exercise. But what we will be seeing today is for only individuals that were present at the time of the survey, and we elicit information on their intentions. But in terms of subsequently whether they actually migrated, this is something that we don't have at the moment.
Okay, thank you.
Yeah. Okay, moving on, basically I mentioned that the fieldwork was conducted in the rural part of the country. So basically these are the farthest regions from the capital city. So this is where the settlements are located. So just briefly in terms of the pandemic with the context of the Gambia. So the first case was recorded back in 17 March 2020. And when we did the fieldwork, it was in September 23rd. And at that time, in terms of number of confirmed cases, we had about 3,555 confirmed cases and about 110 deaths. And these were the number of recoveries. And we had about 1,521 active cases. So obviously we had to have some recommended health guidelines, because we had to have approval from the ministry, which our field workers have to follow some recommended guidelines in terms of during the field work. But it is worth highlighting that most of these residents at these regions were not actually following this. There are a lot of social interactions that are observed in terms of people not wearing even masks or shaking hands. So this is something that was observed. So in terms of the experiment,
may I interrupt you? There is a question from the chat. So the question is what was the rationale for undertaking the survey only in rural areas and not in Banjul? And also a question on the age. So why the 33 specifically and not something else? If you can clarify that.
Yeah. So the first one is why these two regions. So this is part of a larger project that we are implementing, which we started in 2019, where we are doing some experiment where we give people information about irregular migration and also give people possibility of migrating to neighboring Senegal. So these regions were selected because of the fact that they are the regions with the largest share of irregular migrants. That's why they were selected during that time. And in terms of the age, basically these are the ages of, within these ages, we observe that people are more likely to migrate irregularly. That was the rationale why we restrict this respondents to these ages, okay? And because of that, and also we focus on people who are males, because from the data from the labor force survey, actually about 99% of the people that use this irregular route are males, okay? So that is why we have these restrictions. Okay. Moving on, in terms of the priming or the salient experiment. So as I mentioned, we randomized the order of the sections in which people were asked the COVID questions, migration intentions, and when actually they were shown this video. So individuals were randomly assigned into 3 groups. The first group are individuals that we call non-salient group. So for these individuals, basically, they were first asked about migration intentions. Okay, then they were asked questions related to COVID. And at the end, everyone was shown the video about COVID-19. So for the Salient group, these people, they were first asked questions related to COVID-19. So basically the idea is to, before you ask them migration questions, make COVID-19 on the top of their mind. Okay, the third group basically, again, excuse me, these are group that were shown the COVID-19 video, and they were asked questions related to COVID-19 before they were asked questions related to migration intentions. So basically the COVID-19 video, it's basically is 2 minutes video where we convey information related to the virus and how it is spread and how you can protect yourself from the virus, and basically who are the individuals who are at risk of contracting the virus, among others. So basically this is the design. So quickly, in terms of the information that was conveyed in the video, basically, like I mentioned, we talk about the virus, and also we give some numbers in terms of within the Gambia, how many people at the time were infected by the virus, confirmed infections, and the number of people that actually died. Also, we conveyed that at the time, these 3 countries, Italy, Spain, and UK, were the countries mostly affected in Europe. And also how individuals, how the virus is spread, and what you can do in order to protect yourself from the virus. So these are basically the general information that was contained in the video. It was 2 minutes, and it was translated into 3 local languages where individuals decide which language to view the video in. So in terms of identification, basically to understand how does the Salient experiment have impact on migration intentions, basically we estimate the simple model where the left-hand side is the outcomes, migration intentions outcomes, and whether the individual belonged to the salient group or also the group that was salient but also was on the video. And basically we are comparing with people, the omitted group is the non-salient group. And also since individuals were, the randomization was done at individual, this was our base specifications without further controls, but we also use lasso. We estimate this equation by using lasso in order to take into account correlates that might be correlated with intentions and also treatment. So quickly, in terms of the descriptive statistics of these individuals, as you can see on average, they are relatively young, and most of them work in agriculture. 95% of them work in agriculture. And in terms of migration, you can see that 36% of them actually migrated internally, and very few actually attempted migrating to Europe. And in terms of the number of people that they know, on average, 10 people they know that migrated using the irregular backway method, and on average there are 3 people they know that actually died. And you can see that remittances is important. It's about 29% of the households actually receive remittances. And in terms of intentions to migrate to Europe, it's 55%. Okay. So again, you can see overall in terms of comparing the balance by treatment, overall it is balanced. So the first set of descriptive results basically here is to see what happens to intentions to migrate. due to the pandemic. Okay, so how do we elicit that? So basically we ask this question, taking into account all the different effects of COVID-19 on your ability to earn money in your home country, in your home village, to finance your travel, to find work abroad, and on your health risk in either place. What is the overall effect of COVID-19 on your likelihood of wanting to migrate? So this question we ask to everyone. And what do we see? Basically, we see that the interesting thing here is that you can see that for Europe, about 30% are less likely to migrate. Obviously, also for Senegal, we see that about 34% of the individuals are less likely to migrate to Europe due to the COVID-19 pandemic. So the rest, it's we observe very few people expressing interest, willingness to migrate due to the pandemic, 3.5% to Europe and 1.9%. Okay. So the next thing that we did was basically to split these intentions to migrate based on what they said before the pandemic. Okay. So for each of the two destinations here, basically we split the intentions to migrate based on what you said before the pandemic. Okay. So overall, what do we see from these descriptive results? We see that especially people who were not sure about migrating, they are less likely to migrate now, okay, for both countries. 36% for Europe and 47% for Senegal. And even though it's descriptive, but one of the reasons perhaps why we are seeing more reduction in terms of intentions to migrate to Senegal compared to Europe, it's perhaps because of the fact that in terms of gains to migrating to Senegal is relatively smaller than that of Europe. Okay. So moving on in terms of mechanism, we've alluded to some of the potential mechanisms during the theoretical framework. So here we look at some of these potential mechanisms in terms of the ability to earn money in the home village, or also the ability to finance travel to another city. So if you compare individuals that say they are less likely to migrate compared to individuals who said otherwise, so you can see that it's relatively significant. The difference is significant for especially when you consider the ability to earn money in home village, and also the amount that they can earn in Europe if they are to migrate. So overall, what we can take out from this is that the results support our proposed mechanisms in terms of the fact that COVID-19 was in the ability to earn money at home and abroad in terms of ease and cost of migrating, but also the associated health risk abroad. So, so far we've been presenting very descriptive results in terms of without controls. So here what we do is basically to correlate the main outcomes of interest in terms of the first one here is basically whether the individual is less likely to migrate, and the second one is more likely to migrate. The first one is for Europe and the second one is for Senegal. So with adding more controls, what can we take out? We can basically see that by adding more controls, yet people who were very much uncertain about migrating, the effect in terms of less likely to migrate, how COVID-19 impacted their less likelihood of migrating, it is larger for individuals who were not sure in the first place, and also individuals who are very much constrained. As you can see, if you look at for individuals coming from households in which a household member skipped a meal, at the baseline, the observed effect is larger. by 7% larger. And similarly for Senegal too, we can see that individuals who were not sure about their intentions to migrate observed the largest reduction in terms of intentions to migrate. Okay, so also it is interesting if you look at the individuals that say they are more likely to migrate because of the pandemic, even though remember that it's just 3.9% of the individuals for Europe and 1.something% for individuals to Senegal, but you can see that because individuals stop receiving remittances, they are more likely to express their willingness to migrate, at least for the destination, Europe as a destination. Okay, so overall, what can we say is that COVID-19 has bigger impact of individuals who were uncertain about their initial migration and people coming from poorer households. Okay. So next, here we present the results from the Salient Experiment. What do we see overall, irrespective of the measures that we use, whether it is the likelihood of migrating to both Europe and Senegal, or even if you consider the outcome which is specific to irregular migration or expected earnings, what we see is that irrespective of the specifications without controls and controls chosen by LASO, we do not observe any differences in terms of when you compare people who were coming from the Salient group and people who were coming from the Salient group with the video experiment. So we can say that making COVID-19 salient within this setting has little impact in terms of migration intentions. Okay, so perhaps one of the potential explanations for this is that, well, one of those reasons might be just because the way we measure intentions. We measure intentions within the 5-year period, within the next 5 years. That's how we frame the intentions to migrate. So basically, it is possible that actually the pandemic have impacted in terms of the timing, but not the decision whether you will migrate or not. That's one of the potential explanations. The second one is that perhaps COVID-19 is actually already salient. Making it more salient doesn't make any differences. So that we can see from the data in terms of the knowledge of COVID-19 and passive risk of infection. If you compare people who were in the Salient group versus people who were shown the video, actually in terms of the knowledge about COVID-19, they are not that statistically different. Okay, the only thing that we can see is that in terms of knowing that Italy and Spain are the worst countries, because this is something that was conveyed in the video, which is the thing that might be the only one that is relatively new to all these people, because people in general knew a lot about the pandemic in terms of border closures and even the passive risk differences. Okay.
Tijan, can I interrupt for a question? Sorry. Yeah. So you said that you randomize at the individual level, right?
Yeah.
So another explanation might it be that there are spillover effects among individuals who took the experiment and who didn't, and maybe it's something you could actually test if you measure how much they talked about either COVID or migration with family members, friends, and so on.
Thanks, but yeah, within our setting, the contamination issue, it's not something that we will observe, because what happened is that people were actually shown the video on the tablet, and the grouping was done, and you were asked these questions about migration immediately you saw the video or before you saw the video, and there is very little chance that people will talk about this and this spillover effect. The only thing that perhaps might be possible, obviously, because these are within within each settlement, we can check for this, but within each settlement, unless we have like callbacks, like we have callbacks where these people were not there, and because we saw a video about COVID-19, before we do the callback, these individuals might have talked about COVID-19. Yeah, this is something that perhaps we can be able to check within our data. But in terms of contamination, I would say it is relatively limited, but thanks, we can check.
Thank you, Tijan.
Yeah.
I may also, sorry, can I ask a question?
Yeah.
So it's also that maybe I'm mistaken, but in your Salient, I mean, in the messages that you give, it seems to me that everything is turned around health risks. And perhaps those migrants are more concerned about economic consequences. But since you did not make that salient, maybe your message was somehow very truncated and does not really affect their intentions because they are about health. And those people are more maybe concerned about economic things, the consequences of COVID. So if you had done your message about these other aspects, which are very important, it may have had more effect.
Yeah. So yes, thanks for that. Maybe that's one of the reasons. But what we can do, I think, within this setting is that because, like I mentioned, these respondents are part of a bigger study where we conveyed information about a lot of things about migration to Europe, especially, and migration to Senegal. So we might be able to cross-check this within that group. Yeah. But yes, thanks for that.
Your model is really about both economic and health effects of the COVID. And in fact, you don't really, for the moment, test for that. And I think this is very interesting.
Yeah, thanks. So, I mean, the next slide is basically, I conclude. So we use a large panel survey of young males in order to assess how the pandemic impacted migration intentions to both Europe and Senegal. So what we observe is that the pandemic actually reduces intentions to migrate for both destination countries. And this is especially for individuals coming from poorer households and people who are liquidity constrained and people who were unsure about migration. So irrespective of this, what we can say is that still there is a large desire to migrate to Europe, okay? And this suggests the need for exploring policy options in order to open legal migration alternatives. And as part of our contribution also within this setting, we illustrate how you would be able to use priming or salient experiment within the context of migration studies, which might be something that can be done not even within the context of COVID, but anything that might be something that affects migration decision within, you can potentially apply this type of experiment in order to understand certain outcomes. Thank you.
Thank you, Tijan, for this nice presentation. So I have first one clarifying question that is coming from the Q&A, and I think it might be helpful to take it now. So can you clarify the timing in your questions on intentions to migrate? So I think at some point you said something like within 5 years. So is there anything like this, like whether this is short term, medium term, or so that was the question.
No, we asked individuals within the next 5 years. So this is the only timing that we use within the question. Okay,
so it will be something like intention to migrate like medium term or medium to long term or something like this, right?
Yeah.
Okay.
So yes, it is within 5 years.
Okay. Then there is another question from Giuseppe. I think maybe he wants to ask. Well, I mean, let me read it, and he has other questions, then I will give him the floor. So the question is, were you able to measure the awareness of potential migrants and the differential effects of COVID-19 on border closures across Europe and Senegal? On this specific thing.
The only question that we asked individuals was related to borders, whether they know that the Gambia-Senegal border is open or it's closed. Yeah.
Okay, so you cannot really tackle that question, right? I mean,
no, we can only say something about that particular border because we don't elicit any information relating to borders within Europe.
Okay. Any other question? Giacomo, question? Yeah. No, it's fine.
Me?
Yeah.
No, I didn't raise my hand. So if
no, it's fine for you.
Okay. Well, no, actually, I had a question. I mean, I had several. I think it's really interesting work. But one is in particular about using migration intentions. So I understand that it's something that is quite used by now, and I think it's a great instrument. I was curious to understand whether you think that the misrepresentation that you might have about choices of actual migration depends on your group, because I see that you rely heavily on this measure to make heterogeneity analysis, say by whether people are poorer and where they live and so on and so forth. And you know, there's some social desirability, there are some other effects that might make you misrepresent whether you intend to migrate or not. And I wanted to know whether you have an opinion about whether these effects are kind of homogeneous across the population or not, and whether they might actually explain some of the differences you find in your descriptive analysis.
Yeah, I will speak a bit about the intention. So what I could say is that obviously in terms of the literature, you know that intentions are very much correlated with actual migration. But related to that, within our setting, I would say that in a different study that we did where we elicit intentions within a lab, I would say that we've done a couple of follow-ups, and now we can see that what people actually express in terms of intentions, it's correlated with actual migration to a certain degree that I can be able to say definitively. But in terms of heterogeneity about how the forming of intentions depend on other factors, that I don't know. But it's something that we would be able to see.
Okay. Giacomo, do you want to ask another question, or I go with mine?
Go, please.
So, so I have a question on. So maybe it's the stupid question because I don't know the context in the Gambia. But so I mean, you know, like in Europe and countries like this, people like the politicians, they reacted to COVID by basically with a lot of redistributive policies, right? Like giving money to people and trying to help them and everything. And so I was wondering whether something like this, particularly given that you're looking at those rural regions that are, I guess, the poorer in the Gambia. So I was wondering whether there was anything like this the last month.
So yes, in terms of policies that were implemented within this setting, there were a lot of aid, even cash transfers were something that were conducted. We actually collected information on that in terms of whether the household actually received cash transfer or even food, because food was also distributed, especially to these rural regions. So yes, we do have that, but overall, everyone actually received this gift or these transfers. But yes, this is something that was also implemented in Gambia.
Okay. Yes, sir, you have a question? I think you can unmute and directly ask it if you want. No? Yes? Ali? Yeah. Yasser? No? Okay, then Alice, please go ahead with the question.
Yeah, sorry to ask again a question, but I was just wondering whether you have any evidence about whether the risk of migrating illegally has increased. I think that's what you assume with your model, or that's what you discuss. But I thought that perhaps it's not the case, because as everyone now cannot migrate or cannot move, perhaps it kind of gives some more a higher probability of success if you try to cross the borders illegally. Because
so there is actually a report that suggests that this report that we cited here, that suggests that actually migrants that are using this route, they tend to, because of the fact that borders are closed, smugglers tend to use riskier channels of migration. This is a report
but
that
borders were closed before, and those people maybe, I mean, if I understood, these were people who were likely to migrate illegally. So, and enforcement is limited. So if you use your enforcement,
yeah, so because of the fact that especially in Malta and I think in Italy, there were some limitations in terms of people unbarking using these destinations. So what happened is that people were diverting from trying to reach Europe through those routes by using the longest route. This is something that we actually observe in terms of the data, the number of people that try to reach Europe through the Atlantic route, which is the longest, right? From, if you take a boat from Gambia or Senegal, trying to reach the Canary Islands. So there is this kind of substitution. People were moving from relatively safer routes to a longer and riskier routes due to the enforcement.
So the risk is increased. That's what you basically you say. Okay,
yes.
Great, thanks. Maybe it's you're surely right.
Okay, then Yasser, are you able to ask the question? It's fine, no? If you cannot ask it, just write it in the chat or in the Q&A, and then I can tell the question to Tijan. Joel, you should be able to unmute.
Yes, thanks. Can you hear me?
Yeah, sure.
Thank you very much. Very nice presentation and paper. Actually, my point or my question was quite related to what Alice just said. So my reading of your results is you interpret the COVID situation as a kind of short-term shock that would increase the perceived risk or the perceived costs associated to migrating illegally. But people still perceive that that shock might eventually disappear and rather disappear in a rather short time. And so people are still willing to move or to migrate within the next 5 years. So now in your reply to Alice, you mentioned the Malta and Italy borders, but I was much more thinking about it in terms of the steps before. So do you know how long a migrant would on average take to reach the let's say the Mediterranean, where he could then take border boats in order to go to Italy or Malta? Because I guess, so from what I just said before, my understanding is that the story could be that migrants now perceive that it's more difficult to actually reach the Mediterranean area. And so I was also wondering whether there is a perception in terms of an increased border controls within Africa compared to the situation pre-pandemic, whether that would be the channel that people are afraid of because they think that crossing all these countries in between the Gambia and the Mediterranean would be more tricky, more risky, and therefore also more expensive. Because at the end, it seems that indeed, and I think you write it even here in the conclusion that, in your conclusion, that it seems to be a story where costs are rising, people no longer have the remittances to pay for them, and therefore they need to postpone basically the move.
So yeah, thanks. Yeah, I mean, in terms of the time it will take, on average, it takes a couple of weeks. We actually asked this in a different study. I don't know exactly how many days, but a couple of weeks at least. And once they arrive, they take longer, obviously, in terms of transit. They spend a couple of months sometimes in the main transit, which is like, it is not going to take a lot of time for them to arrive to say Libya or other say Morocco, if they are thinking about going to Spain. So that is that. But in terms of this perception, obviously a priori, that's what I would think. I mean, because individuals, even if at all they don't necessarily know how border closer enforcement within Europe is, but given that they know, almost all of them knew about the Gambia border being closed due to the pandemic. So this might further signal that it is going to be relatively difficult for them to cross all these borders to reach to the place where they would need to use a boat, for example. And also the other thing in terms of postponement, this is something that I think it is a possibility. Basically, what we are, why we don't observe these differences, like I mentioned, might be because individuals, their main decision in terms of migrating or not haven't changed, but when. Okay.
So if I may just add a short follow-up on that, I guess what I was wondering or also thinking about is, and you mentioned this in your model, at this stage, you can't really say, or can you say something about how migrants' perception about the economic situation at destination or a potential destination evolved? Because that was one of the mechanisms in your model, right? Migrants could postpone or avoid wanting to migrate because they now think that the economy in Italy and Spain is basically down, and so it's much more difficult to now to find a job there. Is there any suggestion about that part of the channel or of the model?
Yeah. So thanks. We had recently a discussion about this with someone, and exactly that. So basically, what we did not collect that specifically, but the remittances might be some kind of a signal, because we have information whether you are receiving remittances now or before. So if you are no longer receiving remittances, this is something that might signal how bad it is in the destination country. But also we need to be a bit careful here in terms of because what happened is that a lot of remittances was done through how do I call it, informal channels. And especially for Gambia, there was this shift in terms of people now using more formal channels. But yes, I mean, the remittance would be able to, I think, give us this idea about the signal whether things have become worse. If you were receiving remittances before pandemic and now you are not, so this is an additional signal that we can be able to use. Yeah, thanks. Thank you very much.
Okay, then Giuseppe, you have a question? That will be the last question, and then I give the floor to Elsa to end up the seminar.
Yeah, can you hear me?
Yeah.
Yeah, thanks for the presentation, first of all. I think it's a very interesting question, a very interesting paper. In relation to what Joel, Alice, and also Luca have said, so you are controlling for the economic channel, both in terms of the potential earnings abroad, as you said, as signaled by the remittances, or the redistribution domestically. But as it has been pointed out, since we're talking about illegal routes, maybe the increase in the fatality risk, let's say, in the travel, for instance, to go to Italy or another European country, as a result of COVID, is smaller in relative terms with respect to the increase in travel costs that you would have with respect going to another African country like Senegal. So what I'm trying to say is that perhaps part of the difference in the magnitudes that you find across Europe and other African countries might be due to the fact that the cost of migration and the risk of death, whether it's sanitary or not, is probably different. I don't know if I made my point clear. Sorry.
Yeah, sure. Yeah, in terms of differences due to the risks of dying due to the pandemic, yeah. So that might be within our model. We assume that this is one of the potential explanations for why it is going to be people will less likely to migrate. But again, in terms of why we observe the differences, one of the reasons why perhaps we observe larger differences, overall, it is more expensive, obviously, to migrate to Senegal or to Europe. But in terms of the cost of migrating to Europe, it's relatively larger than that of Senegal. But again, in terms of perhaps why it is the case, we observe larger reduction in Senegal. This is something I mentioned in the presentation, was because of the fact that the gains coming from migrating to Senegal is relatively lower compared to migrating to Europe in terms of net gains.
Okay, thanks a lot, Tijan. Thanks again for your presentation. Maybe you can just stop sharing your screen that I will just advertise for the next seminar. And I'm taking this time just to tell all the panelists and all the participants who want to stay, we can continue discuss this paper a little bit longer on this Zoom room. So it was a pleasure to have you in this seminar, Tijan. Thanks again.
Thank you.
And just to advertise the next week, we will have Rama, who will present a joint work talking about immigrant supply of marketable childcare and native fertility in Italy. And if you want, you will be able to register as panelists for this next session and interact more closely with Rama and the organizers. So just to let you know that all the comments through the Q&A box and the chat box will be sent to Tijan, so he will know all your written comments, and the presentation will be available soon on our website. If you want to share a feedback with us, there is also a feedback form in our website. So if you want to have any comments on this seminar, please feel free to tell us. And we are still reviewing submissions. So if you want to submit a paper for this semester or the next semester, you can send it to us at the junior address. So thank you, everybody. And those who want to stay, please stay a little bit longer with us.